Here we are again, Tim.
Yeah, it's good. It's good. The sun is shining.
The
You
sun
know,
is shining, and we're going to talk about back pain today because I was on Paulette's radio show, BBC Radio Sheffield, and it was the phone-in sort of topic. And of course, there's so much interest in this, isn't it? So we thought we'd talk about back pain today.
yeah, and this really is our kind of bread and butter, I suppose, both as GPs, but also with our interest in chronic pain, where we met in the pain clinic 20 years ago or so. It's been, yeah, that's the thing we kind of come across the most is back pain and neck pain. I suppose those are the things we commonly see.
Absolutely. We bonded over back pain, Tim, didn't we? That's where we first sort of like realized our shared interest in, helping people to live well with these things that can become real, real issues in life, can't they? Back pain can be a real problem for so many people, can't it?
Yeah, and I suppose by the time people end up at the pain clinic, they've been through a lot.
Yeah.
They've suffered a lot themselves and have also seen loads and loads of people who can't seemingly help them, and then they've ended up at the pain clinic. And sometimes, I suppose, even there, some people absolutely that doesn't work for them either, I suppose. And that's why I think we find our way into kind of a coaching approach because what we realize is the people who did well were those, I suppose, who realized they had a contribution to make. And I suppose that's what I'd like to kind of talk about today is a little bit is about how people can start to change their thinking about their pain because that seems to be really crucial.
Absolutely. Okay, well, we'll get to that. Let's just start the. So, I mean, back pain's really common. I don't know about you. I've had bouts of back pain through my life. Have you had back pain, Tim?
Yeah, exactly. And in fact, I was on a long journey yesterday in the car and kind of noticed it niggle a little bit, but then it kind of goes away again, no problem at all. What about you?
Yeah, absolutely. I mean, I'm quite tall all my life, but it's interesting, isn't it, as a doctor, sort of some things you've experienced, some things you haven't. But back pain's definitely been a thing for me. I've had periods from teenage years of long periods of back pain, and I think I managed it really badly when I was younger. In my young 20s and 30s, I'd get really worried. I'd stiffen up. I'd get paranoid about how long it was going to go on for. I'd stop doing things. I'd be careful about what I was doing. I'd be, bending over very carefully. I'd be really awkward. And I think what I've learned now is that that really wasn't the way. But, there's this feeling, isn't there, that, back pain, you get bout to back pain. It's a normal part of life. Very frustrating when it happens, but it's very normal, isn't it?
Exactly. So for the majority of people, absolutely get bouts of kind of acute back pain. It's there for a period of time and then it kind of fades, goes away, and people are able to carry on as normal. But I suppose what we're talking about today is that chronic pain, which just doesn't seem to go away and just lasts way beyond kind of, I suppose what they call about the kind of the tissue's normal kind of healing time, which is kind of 3 months. That's the kind of definition, isn't it, of chronic back pain is that length of time beyond which the body would normally heal. And the body is amazing, isn't it? Just kind of at healing.
Yeah.
And it's just therefore what's going on then for those people where the pain persists.
Yes. Yeah. So we're programmed to heal. It's normal, very frustrating. Get these bouts of back pain. And what we know about these acute back pains now is that it's usually not that you've injured anything or anything sort of really serious is going on. It's more that the kind of like the muscles and the nerves have got tight, maybe we'll talk a bit about sort of the mental and psychological side of it, the emotional side of it, but it feels awful. But usually it'll go away by itself. You don't need to go to a doctor. Maybe you take a few painkillers, but usually just keeping moving and it goes away, doesn't it? That's the whole advice now. Keep moving. But sometimes it is worth getting things checked out, Tim, isn't it? How often is back pain something to really worry about?
Oh, really, really rare. I suppose kind of it's kind of 1% of people where the back pain is due to kind of a serious cause. And I think things like, I suppose the big one that people maybe worry about is kind of cancer. And then there could be kind of trauma, kind of fractures or breaking in the bones, I suppose. And then infection and inflammation. I suppose those are the big ones to kind of rule out. Interestingly, I was always reassured, by people who came and they said had that pain for years. I would almost kind of relax a little bit to some degree as a doctor because I think, well, actually, if you've had pain for years, there's a really good chance it's not something serious, because otherwise something else would have happened by now. So does that make sense?
Yeah, it does. And doctors, that's what we're there for, isn't it? Is to rule out those serious causes, and a fracture you'd probably usually know if you'd had a fall or an accident. You might have osteoporosis and thin bones, and it might be minor. And again, there are very obvious signs of an infection and cancer that we would look out for and test for, wouldn't we? But that's only 1%. So 99% of the time, it's not serious. A few people get sciatica with it, don't they? Nerve pains down the leg. I think it's about sort of between 3 and 5% of people will get a bit of leg pain with it. That means 95% of people are going to be having the sort of common or garden low back pain. And usually it goes away, but sometimes it doesn't. It goes on to become what we call chronic or persistent. So what's going on there, Tim?
Well, that's really interesting, isn't it? Because it's not then due to a structural abnormality. So in some ways, yes, it's really important, isn't it, to kind of rule out those serious things, but then it's really important then to kind of rule in what might be what we would call neuroplastic pain. And I know that might be a kind of a new term for people, but just to understand that, well, maybe we should go back a little bit, Ollie, because I'm just thinking about the whole kind of concept of pain. We haven't even talked about, well, what causes pain? So maybe it's really important to understand that,
Oh,
that all pain is real, and we need to be really clear about that. So when we're talking about pain and the fact that pain is generated in the brain, we're not saying it's all in your head. And people who say that pain is all in your head are unkind at the very least, but they're also just not understanding what's happening with pain and how it's generated. So there's been a lot of work, hasn't there, in recent years in terms of pain science.
mm,
And so I think even my thinking has moved on in terms of how I understand now about what causes pain. So all pain is real, pain is generated in the brain, pain is a danger signal.
yeah,
That's something that the brain is telling the body you need to pay attention to this thing. Okay, so it's a danger signal. It's there to protect us in some way. But in chronic pain, those warning signals is where the brain is getting it wrong.
right.
And so it's not always, so we think our brains are brilliant, but sometimes the brain gets it wrong. Can I share one example of this? This is quite a
Yeah.
famous one. Is that
So,
okay?
so yeah, so what you're saying is the brain becomes overprotective, if you like, really. It sort of like overdoes the protection. Yeah, but please tell us a good example.
Yeah, so this is a really good example of this. So this was in the BMJ. This is going back probably a decade or so. There
Mm.
was a construction worker who managed to land on a really, really long nail. You can look it up in the BMJ, and this nail went up through their boot, and that construction worker was in absolute agony,
Nail had
and
gone through his
was
foot.
sorry.
Like he saw this nail gone through his foot, and
Yeah, right through the boot. It was absolute agony. He was rolling around. The ambulance came. They gave him loads of really strong drugs, still in loads of pain, got to the hospital, and they managed to kind of remove the nail and then examine the foot. And then what they realized is that the nail had just gone between his toes. So
mm,
it hadn't even pierced the skin.
mm,
And yet he was in absolute agony. And that's because his eyes were seeing this nail sticking up through his boot. He had had probably a little bit of a sensation as the nail passed between the toes, but the signal was misinterpreted as being much more dangerous than it was. Hence, severe pain. Does that make sense? So absolutely, we have these body kind of sensations, but our brain misinterprets them as dangerous and therefore generates pain. Does that make sense?
it does, and that is where this word neuroplastic come from that you mentioned earlier on. Is that right? So,
Yeah. Exactly. So the pain is generated by neural circuits in the brain rather than, well, I think we had this idea that we had these pain nerve fibers and the pain was generated in the fingertip. So if you kind of put your finger on a hot stove, the pain was generated in your fingertip. No, there's an electrical signal which goes up through your fingertip, up your arm, into your spine, into your brain, and then brain decides, is this a dangerous situation? And actually, obviously, if you've got a finger on a hot stove, it is, and you withdraw your hand, it generates pain, and you withdraw your hand.
yeah, yeah, got
So
you.
that's how things work. And what's happening in neuroplastic pain is that even though you're not in a dangerous situation,
Yeah,
that the brain is still generating those warning signals.
got you. So when we're thinking about chronic back pain, if you like, they get to a point where normally, it might have flared up because you've had a flare of the muscles and the nerves. it would normally settle down in most people in a week or two. For some people, it stays on, and actually, it's something about the brain getting stuck in the kind of on mode where it's giving you pain messages from your back, where any tissue damage that might be there is healed up, any inflammation might be there has gone away, the muscles should have relaxed, the nerves should have relaxed, but actually, if you like, these neural networks in the brain are kind of are left switched on, and you're left with this neuroplastic back pain.
Yeah. I mean, the other analogy we often talk about, don't we, is it's like a faulty car alarm. And you know, car alarms are great, aren't they? Because the lights flash and the horn kind of blasts and it draws your attention to a problem that someone's maybe smashed the window to grab a bag or something like that. Really helpful warning signal. But if you imagine that same car gets fixed, goes to the garage, gets fixed, almost like pretty much as good as new. And then sometimes what will happen is that the maybe the wind will blow or someone will walk past the car, and because that car is even more sensitive, maybe the engineer has turned up the sensitivity of the alarm to kind of make it, because they're living in a dangerous area, so they can need to make it a bit more sensitive because we want to get broken into again. Then what happens is the alarm sounds, even though someone's not smashed the window, there's no damage happened, but the alarm signal is exactly the same. So it's still awful. The pain is just as bad as when they had something severe happen, but it's happening even when that is not happening.
Absolutely. So something in some people has sort of, if you like, sensitized the system that that kind of back pain that would normally go away and settle down hasn't settled down. It's left, if you like, in that persistent on phase. And of course, as a result of that, people stop doing things, don't they? They get very worried. They feel they ought to sort of stop moving often. Perhaps their joints stiffen up a bit, their muscles get a bit weaker. So there's a little bit of physical stuff that happens as well. And you get a kind of, if you like, a sort of compounding situation where then because they're a bit weaker and a bit stiffer, that makes the brain even more worried, even more on alert, even more overprotective. So there's a sort of bit of a vicious cycle going on here, Tim, isn't there?
Yeah. I've heard Howard Schubiner, who's a physician in the States, going to talk about this quite a lot. And he talks about the six F's. I don't know if you kind of come across this, but you've absolutely kind of mentioned one of them there, which is fear. So things that kind of almost perpetuate the chronic pain problem. So one is fearing it.
Yeah.
Another one is trying to fight it, right? Trying to kind of battle against it. Another one is being really frustrated with the pain.
Hmm.
Another one, interesting, is really focusing on the pain, which is quite difficult, isn't it? When you have something which is so awful and so kind of overbearing, it's difficult not to focus on it. The other one is trying to figure it out, and
Hmm.
the other one is focusing on trying to fix it. And lots of people we kind of come across, don't we? You know, kind of when we're working as GPs, but also in the chronic pain clinic, they have been around the houses. They've seen lots of different people, all giving them maybe some slightly different explanations for their pain. Because we want to do that, don't we? In the helping professions, we want to help people understand what's going on. But I think sometimes in our desperation to try and explain it in our own way, one, I think it's confusing. And two, I think we're giving people the wrong idea. I think we're giving them the wrong messages. So we might do investigations and it might show degenerative discs, or it might show a bulging disc, or it might show some facet joint issue. You know, we're talking about low back pain.
Yeah.
And we kind of pin it all on that. Oh, that's the reason you've got pain, which again, for people who have pain, I'm not sure how helpful that is because it almost heightens up that kind of danger signal. There's something wrong with your back,
Yeah.
and therefore you need to be careful.
Yeah, and
Don't you?
that being careful is the key thing, isn't it? And if you think you've got a little bit of arthritis or a bulging disc in your back, that's evidence that you should be careful, isn't it? And what we know now, don't we, is there's no correlation between the findings on your X-ray of your back and you're likely to have pain. So there's what 80 odd percent of the population walking around with some, arthritis, degeneration, bulging discs in their back with absolutely no pain whatsoever. They just have it there. And then some of those people who have got back pain for other reasons, this neuroplastic reason, they have an X-ray, it shows some degeneration. They go, well, that's what's going on, and of course, and that's permanent, and that's it. That's me. I'm done. I'm glad one of your six Fs wasn't what I was thinking, but we don't want to help make people think that there's something wrong with them and that they're flawed for life. This is something that people can recover from and get a lot better, isn't it, Tim?
Yeah, and I think that's the thing, isn't it, with those, which is why X-rays and MRI scans even are really unhelpful, aren't they? In most people, because actually what they will do, because they're quite sensitive tests, they will pick up things
Yeah.
which are, I suppose, what we would call normal abnormalities.
Yeah.
They're just part of the process of getting on in life. But those changes start really quite early. Even people, half of people over the age of 30 will have degenerative changes.
Yes.
If you're thinking, I'm
Like your
30.
hair going grey or your skin going wrinkly, Tim, they sometimes say, don't they?
Well, I wouldn't know, Ollie. But yes, exactly. For some
Oh,
for
well, I've got
some
a few
people,
few flecks there. No doubt I've got some arthritis in my back, I'm sure, but it doesn't stop me from running and moving around and doing things now because I know that's so important for keeping my back stable and strong, actually.
yeah. So
So
we've got
neuroplastic pain in the back then, Tim. So what you mentioned Howard Schubner. There's been there was a very famous study not that long ago, wasn't there, when they were thinking about alternative ways of dealing with low back pain. So do you want to go on and talk a little bit about the ways that you might, a more productive way to help someone recover from neuroplastic or chronic back pain?
Yeah, well, I'll say a little bit about it, but if people wanted to find out a little bit more about this, then I think that the Alan Gordon's book, The Way Out, would be a really good because I think a really good look at that one because it does go into the back pain boulder, the boulder back pain study, which I think is the thing you're talking about there. So yeah, so they kind of took 150 people, they randomized them, kind of about kind of 50 people in each arm of this. One was for pain reprocessing therapy, which is this new way of thinking about pain from a place of safety as opposed to fear, which is the thing that kind of tends to drive the pain. Another one was a kind of placebo injection. That was another arm. And then the other one was kind of usual kind of education, what people would normally have with a chronic pain problem. And they found with the pain reprocessing therapy that around two-thirds, I think, it was really impressive.
Yeah.
And these were people who'd had pain for years. And actually, two-thirds of them had none, no, or very little pain at the end of that intervention. So I think it was twice weekly sessions. I think I've got that right,
Mm.
over a period of a couple of months. So but still, from not ha from being in quite well reasonably severe pain, or certainly pain that they'd had for a long period of time, to nothing or very little pain, that was probably the most impressive thing I've seen in my years. I don't know about you.
Yeah, well, so this is probably some of the best evidence, isn't there, of a new way of approaching long-standing back pain, then, isn't it? So you called it pain reprocessing therapy. So tell us a little bit more about the sort of principles behind that. What's going on there? What are they actually doing when they're, so it's getting people to think a little bit differently about their pain, is it?
Yeah, so it starts off, I suppose, people being open to the idea that the pain is being generated by their brain, which is a new understanding about how pain is generated, and then observing that pain or relating that pain from a place of safety.
Mm.
And that being the most important thing. Because often what happens is people who experience pain, they go into those kind of six F's quite quickly. The fear is absolutely there for all sorts of really good reasons.
Yeah.
And what we're trying to do is kind of support people and help them kind of settle down or dial down um, that kind of fear element, so that they can actually kind of almost develop a kind of a bit of curiosity about that pain. What's that pain kind of telling them about what's going on for them? And they do need some people obviously need some training in doing that. I'm not sure that's going to be widely available for people,
Mm.
but you can read about it in that the Way Out books, and so that's what I would encourage people to do. And there's also an app which I know you've come across as well called the Curable app,
Yeah.
and I think that is one that I've heard really good things about in terms of it accompanies people on that journey. So if people wanted to kind of look at that or look at that way of thinking about their pain, that would be the place to go.
Yeah, great. So it's really interesting, isn't it, that I mean, we've been on a journey with this through the pain clinic, haven't we? Having come from a position where we used to give a lot of injections when we were giving epidurals to chronic back pain, we were prescribing really strong opiate medication. And now actually, there's a real emerging area of science, isn't there? A real feeling of optimism, isn't there? That actually It's not just about saying, oh, it's just in your brain. You've just got to think your way out of it. It's recognizing that you can give really good quality support and some very scientific exercises that people can practice themselves alongside. I think, am I right in saying that alongside helping people to feel safe to move again, getting movement patterns back again so that you do feel safe to walk, you do feel safe to bend over and pick things up. Those that goes along with this kind of like renewing your confidence about that it is possible for this pain to settle down. Is that right, Tim?
Yeah. So again, some of those terms that we use really trying to be helpful, degenerative back pain.
Mm,
If you say someone, your spine is degenerating, it's really scary. You think, oh my goodness, people, if you say with the word degeneration, it feels like something that's going to get rapidly worse and I'm going to almost like fall apart.
yeah.
I remember again someone else saying that their spinal surgeon said their spine was like a crumbling biscuit. Oh my goodness. If you
Mm.
heard that, how would you move? You probably wouldn't move at
You'd
all
be
because
careful.
you'd be
You'd be
so
very
worried.
ginger, wouldn't you? You'd be like, oh my goodness, I got to be really careful. I don't want to kind of crumble this biscuit.
Yeah, indeed. There's other, but then we think, oh no, can't use degeneration. So for other people, we use wear and tear.
Mm.
Oh, and again, that's not helpful, I don't think, because people think, well, if I've got wear and tear on my back, then the way to kind of make my back last longer is to not wear it so much. You know what I mean? So they kind of then still don't move very much.
I know, and we've come on so far, haven't we? All this thing we used to think about your posture, and if you're not lifting right, then your back's going to go, and you're wearing things out. We've come a long way from that, haven't we? Actually, those sort of things often make things worse because they make you more tense and more mindful of what you're doing. Isn't it like that focus bit, and you're being very ginger. Actually, we want to get people to feel safe, don't we? Just to move normally, to bend normally. And actually, they say, don't they, the best posture, I've heard people say the best posture you can have for your back pain is the next one you're going to adopt because it's around changing your position and moving regularly and keeping things moving rather than any particular posture. And that kind of posture thing, often, working on the strength of your core to support your back, it's nonsense, isn't it? Actually, that ends up making everything stiffer and tighter. And you, again, just more mindful of being careful. It's such a dangerous word for your back, isn't it? Being careful.
Yeah, I really like that actually as your next because otherwise, because people fear about getting it wrong, don't they?
Yeah.
And then if they have a flare up of their back, what they often then tend to do, oh, what did I do wrong that meant my back flared up? And
Yeah.
so they kind of analyze, oh, it's because I sat too long or because I walked too long or I overdid it. And it kind of then makes people really fearful and really worried about doing the next thing. So I love that kind of that thing about the posture thing. It doesn't matter which posture, it's just as long as you are keeping moving. And I suppose with people where their pain is really, really severe, what we might do with people is just get them to imagine moving first,
Mm.
which might seem, oh my, well, that's a bit of an odd thing to do, but actually our brains are predictive machines. So
Mm.
sometimes even thinking about a particular movement. So for instance, if your back pain was triggered with bending forwards, for instance, you might even just start by closing your eyes and just imagine bending forward and notice what happens.
Wow.
And people with neuroplastic pain, not always, but sometimes will get that sensation of pain even with imagining that movement, which is, again, evidence of it being a neuroplastic problem.
So what I'm hearing, Tim, is it's all coming round to this, whatever approach it is, of helping you to return to a feeling of it feels safe for you to move, to do everyday movements of your back, whether that's bending, whether that's going for a walk, whether that's running or cycling or swimming, whatever you enjoyed, whatever movement or whatever sort of functions of life that you used to need your back for, is getting to a point where your brain is reassured it's safe enough for you to go back to those. That's the ultimate aim of what we're trying to do with this.
Exactly. We're trying to dial down that danger signal or reset that danger signal because it's not that we're not getting these sensations from the body with the things that we do. It's just that the brain is misconstruing or misunderstanding the level of danger which is accompanying those signals.
Yeah.
So yeah,
Really interesting. Yeah, it's really interesting, isn't it? So it's been very interesting for us, isn't it? Having been on that journey, like I say, from the pain clinic and sort of, and I guess what's lovely and what's relevant to health coaching is that we're seeing more and more health coaches, aren't we? Training in some of these kind of like psychological techniques, which goes alongside helping people to move well, helping people to eat and sleep well, because actually often one of the things that puts the brain or keeps the brain stuck in this kind of protective mode are some of the other threats of life, aren't there? We recognize now these metabolic threats to our body of, eating a poor quality diet, of not sleeping well, and, having a lot of sort of emotional stress and strain. We actually know those sort of other threats that keeps this brain in this overprotective mode, which is weird, isn't it? We used to think it was a physical thing that had gone wrong with the body, but now actually we realize it's a lot of the other kind of factors that contribute to how safe the brain feels that are very amenable to the work of a health coach in helping people to kind of change lifestyle things and tune into parts of their life that they may not have realized are affecting their physical body.
Yeah, exactly. I mean, where that's the kind of the role, isn't it? Where the health coaches are kind of absolutely working their best when they are providing a space where people can unpack what is going on for them in all the aspects of their life. Because what we know in kind of chronic pain, there's a whole load of other stuff which is going on, which is influencing someone's pain situation. So it's not just about.
Influencing how safe the brain feels, really. If you've got social threat or emotional threat or stress or even metabolic threat because you're not eating well or sleeping well, your brain is more likely to go into this overprotective mode. Is that what you're saying?
Exactly, exactly. So we need to pay attention to all of those things, and that takes time. And I suppose that's what we don't have, isn't it, in the kind of the healthcare sector generally. You do not have lots of time, especially, maybe GPs and the hospital specialists, and we don't have loads of time. But what the health coaches have is that luxury of time to spend with people, and I suppose health coaches having an understanding of this new way of thinking about pain is helpful. It's not for them to be giving advice. That's not what health coaching is about. But providing information to people in a way that they can grasp it, I would say, is absolutely crucial to helping people dial down that kind of danger signal of what's going on.
Yeah, it's interesting. And I go back to that boulder back pain study because that was really had an impression on both of us, didn't it? And I know that within a month of working with a health coach, so we say time, people's average pain score had gone from 4 out of 10, which is quite intrusive in your life, to 1 out of 10. And as you say, a third of people it had gone completely. And that was within a month. And actually that was maintained then for the 12-month period of the study. So there's something, isn't there, about people who've had pain for a long time working with people in a coaching style to kind of address all these aspects of life, the physical, the emotional, the psychological, how they're moving, how they're thinking about their pain, all those things have a really significant impact.
Yeah, and they last. And the reason they last is because we're training people themselves to do this work for themselves. It's not like you're going to see someone who's going to do something to you, which then when your problem comes back, you have to go and see someone else to have the same thing done to them. It's not that. It's people doing this work for themselves. And I think there is work, people have to do. They have to practice this way of thinking to kind of calm down their danger signal, their pain system. They have to do that work,
Yeah.
but it pays dividends in a relatively short time and it continues. And I think that's really encouraging. And I'm not for everyone. It's not for everyone. This is not the kind of necessarily the panacea, but I think it is something that people can do for themselves, and therefore it is sustainable. And I
Yeah.
think that's really exciting to me.
It's really exciting, isn't it? I think we're seeing real tangible evidence of this, aren't we? I mean, we've worked closely with Pure Physiotherapy, who I know one of the biggest providers of physiotherapists across the country. Physio is great for acute short-term pain, isn't it? Sort of knee pain, shoulder pain, back pain, and so on. But actually, what I've seen Pure doing is they're now investing in health coaches because they realize, a huge chunk of the work that used to come through physiotherapy is actually long-standing musculoskeletal pain, of which back pain is the most common, isn't it? Back and neck pain, the most common. And actually, they're finding that training health coaches in this kind of like the methods we've talked about are actually the most effective way of helping people to get back to normal life and indeed get back to work. And that's what we've seen a lot of, haven't we? There's all this worry at the moment, isn't there, about people being off long-term sick, particularly over the age of 50. Often it's low back pain and things like that, neck pain, back pain. And these treatments, we should stress, are they work at all ages. It's not a case of once you're old and you've got arthritis in your back, this doesn't work. Not true. Arthritis in your back is actually a way of your back strengthening up. It gives it a more solid base. So all these sort of approaches are very amenable, whatever age you are, whether you're in your 50s, 60s, 70s, 80s, they are equally as effective. So, old age is not a kind of reason why we should be living with back pain, is it?
No, exactly. And it's again, it's a change of mindset, isn't it,
Mm,
for people? Because people kind of go, oh, well, I'm 50, so it's almost like this is what I should expect, or I'm 60 or 70, whatever. Oh, that's what happens as you get older. You get pain. And I don't, well, we know now that's not true. It's not a function of age
yeah,
that we have pain, but it's just almost in our consciousness. So well, that's what we should expect to have. And therefore, guess what? That is what we kind of tend to experience.
yes,
Um, yeah.
yeah.
So anything more, Ollie, that we want to kind of share
No,
before
we've
we
probably
wrap
come
this
up
up?
to our time, haven't we? But it's an optimistic side of things, isn't it? I mean, I worry sometimes that people will sort of say, "Well, it's all right for you. You haven't got the sort of pain I've got." Sometimes people really are in a hole, aren't they? But I think what we've learned and what we've seen with many patients is that the future's more optimistic than it used to be, didn't it? We used to just say, "Sorry, long-term back pain. You've got to be careful for the rest of your life. Forget it." Actually, what we're coming to now is that much more there's much more on the table, many more options for you, and the sort of health coaching style of approach offers a lot of new hope for people, I think.
Yeah, agree. I've been on a journey with this myself, and I kind of look back at all the times that I spoke to people and said, "Oh, this is, you've got it. This is a long-term condition now. You've got to learn to live with it." And I suppose, absolutely, I'm much more optimistic now that rather than kind of teaching people to live well with their pain, which absolutely has value, I think, still, but even more hopeful is teaching people to live without their pain.
Mhm.
That feels much more hopeful for me. And I suppose why we would really emphasize, yeah, the benefits of looking more into this work. Yeah,
Yeah, brilliant. Love that. So it's much more hope for people with low back pain, that you don't have to live with this for the rest of your life. You can actually learn ways of living without it. It's a great way to finish, Tim. Nice one.
great. Nice to speak to you, Ollie.
Lovely. Cheers.